Hello, welcome audience. Uh, Welcome everybody to Dr. Fazil's TV show for month of September 2022. Um, so I'm trying to bring up every month, as you know, a useful topic which we can use in our daily life to improve our health. And um, today we're going to talk about a topic just like we have done different topics in different shows in the past, something which you can do at your home and change your things which you can add to your daily routine or things you can do to make your life better and healthier. So today we're going to talk about leg cramps. As we know, the pain in the legs is a very common problem. We're not talking about the neuropathy today. Neuropathy is a different topic. Neuropathy is like numbness in the feet, which is a different problem, but it's kind of sometimes related with leg cramps. When patients say they have leg cramps, then it might be actually pain in the feet or in the legs as a numbness. That's a different situation. We call it a neuropathy. Neuropathy is a disease of the nerves. We have nerves in the body. There are two different kind of nerves. Sensory nerves and motor nerves. The sensory nerves take the sensation from the body part to the brain, and the motor nerves take the commands from the brain to the body parts to do function. So when sensory nerves get involved, we get pain, tingling, numbness, and we call it neuropathy. So that's a totally different topic. We'll talk about it in a different episodes of Dr. Fazil's TV show. But today we're going to talk about cramps in the legs, especially when you walk. People get pain in the legs, and the pain goes away when they stop walking, or sometimes doesn't stop, and sometimes the pain comes in the legs when they're sleeping. So first we have to make a diagnosis before we can treat it, right? Just make a diagnosis first as usual, and then treat afterwards. So on that note, let's talk about different causes of leg cramps. So in the body, as you can see right here, we have, I just showed you a hologram of a leg and arteries, and that's the artery going from the heart, right? The heart is right here, and it's going all the way through the aorta to the legs, and then it's come right back to the veins and back into the heart. So let's have this picture on the side for a moment. Now let's talk about what's going on when people have a bad circulation. So let's bring another picture right from here, and you can see right here. So this is an artery which is normal. Let's go to the next presentations. So here comes the normal leg, and you can see the blood is going without any blockage. There's no plaque built up. So what happened is, let's go to this picture on the side. So what happened is that when we walk, the muscles need blood supply, and if the arteries are plugged up with the plaque built up, then they would not get enough blood supply, and after a while they will start to become ischemic. That means no blood not going enough blood to the legs, and it can cause pain of ischemia, lack of oxygen, lack of circulation to the muscles. When it becomes extreme, people stop to walk. So we call it intermittent claudication. And how we diagnose it? Well, first is the history. When the patient is giving the history that when they walk, the pain comes after a while, after 1 block or 2 block, depending on how bad it is, and it stops when they stop walking. So that's very much indicative of most likely PAD, peripheral arterial disease, poor circulation in the legs. That's cause of the leg cramps. Now, in generally, people have other kind of cramps too, like the muscle cramps up. And I have seen patients taking randomly supplements to calm it down. Sometimes it works, sometimes it doesn't. For example, potassium, magnesium. So, folks, I just want to let you know that it could be very dangerous situation to take randomly those medications, because they're strong medications. They are not just supplements. As a matter of fact, I just want to let you know that potassium is used as a chemical which is given to stop the heart in capital punishment. When people get a death sentence, the thing which they pump besides other medication is potassium. That makes your heart to stop. So high potassium can stop your heart. So be careful, especially if you have a chronic kidney disease or a disease of your kidneys. Potassium can build up in your body very quickly, very fast. And sometimes high potassium by itself can cause cramps. So the treatment would be opposite, to take the low potassium diet or take some kind of medication to lower the potassium. So we have to be careful that not all the cramps are the same. So we talked about the poor circulation to the leg, that's one source, and then obviously how you diagnose it, history is the first step. Then what you do is that you examine the patient, and I can bring in this normal patient leg, and I can see the pulse right here in the feet. In the foot, the pulse is there, it's bonding pulse, that means the circulation is good. Okay, let's bring up the second hologram, and we can see right here there's a blockage, and I am feeling the feet, there's in the foot, and there's no pulse. So that's a clinical exam, simple stuff, right? The second easy step is to check the blood pressure in the legs, and if your pressure in the leg is low, then the arms, because the pressure in the leg is supposed to be higher, known as due to the gravity. But if it is lower as compared to the blood pressure in the arms, then we mean there's an indication that there might be poor circulation. We call it, this test as ABI, ankle brachial index, ABI, right? This is a simple test, can be done in the clinic in 5 minutes, and it can make a diagnosis. Could be confirmed with another test known as arterial sonogram. You also do a sonogram to confirm it, and if you have it, then the next step is an angiogram to fix it. The angiogram is, if you have no kidney disease, then, if you have like a mild kidney disease, that's fine, but if it is you have very, very bad kidney disease, you cannot have it. But if your kidneys are normal or close to normal, then you could have it. That's a test where they inject a dye. You can see now here I'm showing this an angiogram being done. You can see here's the dye is going through the arteries, there's a blockage, and the circulation stops right there. So what the cardiologists generally, what they do, intervention cardiologists, they put a catheter inside, and sometimes they just break the plaque. You can see there's the catheter is going in there, and now is causing like a little plumbing job, So it opened up the plaque, and the circulation is back to normal, and symptom will go away. Then down the stream, we have to make sure that it doesn't happen again, right? We have to make sure that all the risk factors, high cholesterol, high blood pressure, diabetes, if patient have it, that need to be fixed and controlled. So that's one scenario.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
So let's talk about other sources of leg pain, right? Cramps. Now the other source could be bad veins, like the arteries take the blood to the feet or legs. Veins take the blood back to the heart, right? Varicose veins are where the valves in the vein that you can see here. This is, I just bring it here, right here. You can see there's a varicose veins, and the blood is not going back to the heart, and that can cause swelling in the legs, and that can cause cramps as well. So arterial disease, venous disease, both can cause pain in the leg and cramps, right? And especially the classical cramps is when you walk and the pain gets worse, and when you stop, the pain stops. That is known as peripheral arterial disease. Intermittent claudication is the name of the symptoms. So once we diagnose it, it's easy to fix. Sometimes we can just open up with just break the plaque, or sometimes you have to put a stent in the legs. Or sometimes if it's worse, you might have to do a bypass of the bad circulation, right? The second step is if you have varicose veins and that is causing pain, that could be fixed by vein ablation. Vein ablation is a procedure where they put you can see here the catheter is going up into the vein, and then what it does is it coagulates the vein, so vein is destroyed. So the blood starts to go to deep veins, which are backup veins, and they are normal, and the swelling goes away, veins disappears, and symptoms get better. Let's talk about other sources of pain. Neurogenic pain. The neurogenic pain can mimic the pain like poor circulation. And the reason is, if you can see, the spinal cord is coming down. The spinal cord is causing, right here there's a compression of the spinal cord, and the signal which are going from this spinal cord to the legs to this nerve, they are also compromised. So classically, they can also cause pain when the patient walks. But the trick is, if the patient is stooping forward, the pain disappears, because when you are standing straight, the spinal cord is more compressed. So it is actually more dependent with the posture than the walking. So classically, what we ask the patient is, if they go to a store, they push a cart, because when you push a cart, you have to stoop forward a little bit, then the pain never comes back, because the spinal cord is more open. So the compression goes away. When they stand up straight, the pain comes back. It has nothing to do with walking, it has to do with the posture. Trick question is, what happens when you walk with a shopping cart? The pain disappears, then it's probably due to bad back. That's where we do an MRI of the back to confirm the diagnosis. If that's the source, then you fix it with the surgery, most likely, right? So we talked about the poor circulation, we talked about the bad veins, we talked about the pinched spinal cord. We also talked about, neuropathy, which is actually a disease of the nerves, totally different symptoms. They have like a tingling, numbness, sleepy legs, not cramps. So we have to differentiate between nerve issues, because nerve problem could have so many different reasons. So that's a whole different topic. We will talk about it in a different episode. Let's talk about electrolytes. Potassium, magnesium, we just talked about it. So if you have a high or low potassium, both can cause leg cramps. It's just not the high potassium. Even low potassium can cause it, and even high potassium can cause leg cramps. So obviously, the only way you can tell is by doing blood tests. You do the blood test, you're going to find out if the potassium is low, we'll give you potassium. If potassium is high, we'll avoid high potassium food. So not the same treatment fits everybody. Folks, please do understand that. So it could be really, really dangerous, sometimes fatal, by taking wrong treatment, right? So, as they say, things which we don't know can kill us, and that's exactly could happen in this situation. So the next thing is other electrolytes like sodium, magnesium. Those things in the blood, if they are high or low, can also cause cramps. So the blood test is important in most cases as a starting point to find out what's the source of the cramps, and then we go from there. Pretty much that's the 95% of the cause of leg cramps. Folks, this is easy to diagnose if your provider take a good history, a good examination with appropriate testing. We can pinpoint the diagnosis. Once we have a diagnosis, then focus on the treatment, and then later focus on prevention so it doesn't come back again. So hopefully if we do that, you can have a better circulation, better power in the legs, and you can walk better and enjoy your life every day as you should. So I hope this episode was informative for you guys, and on that note, I will call it, that will be the end of the Dr. Fazil show for today. So I hope that you learned from this episode, and next time we can talk about other topics like neuropathy. But till that time, have a nice day. God bless you, God bless America, and see you next time. That was Dr. Fazil show. Thank you so much.